Hello everyone, today we'll be talking about cerebral hemorrhage. So how to approach a CT scan that shows cerebral hemorrhage. So the first video generally talked about how to approach a head CT. Then on this one we'll be more specifically talking about cerebral hemorrhage. So intracranial hemorrhage can be epidural, subdural, subarachnoid, intracerebral or intraventricular. So when we talk about subdural hematoma, so that is crescent shaped, able to see this here. It's crescent shaped and then there's blood collection between the dura and the arachnoid matter. So this is going to be the dural layer. It's gone, yeah. The dural layer and the arachnoid. So blood accumulation is between the dura and the arachnoid. So it causes subdural hematoma. This is commonly due to tear in bridging veins. And who are more prone to subdural hematoma? That's alcoholics and elderly. Then let's talk about epidural hematoma. So that's biconvex or lens shaped. Well, to see this, this is biconvex, right? Then there's blood between dura and the skull. So we talked about subdural blood was between the dura and the arachnoid. In epidural, it's between the dura and the skull. Then this usually arises due to tearing of the middle meningeal artery. And who are more prone to epidural hematoma? That's adolescents and young adults. Basically, it's common due to trauma. Then we go to subarachnoid hemorrhage. So this is basically blood in the circle of Willis, cisterns, and fishes. So in the previous video, we talked about the four cisterns, where they're found, the names. So if you're interested, you can go and look at that video. Then this is commonly due to rupture of barrier aneurysms, and people that have got polycystic kidney disease. So this is a risk factor for subarachnoid hemorrhage. Then this is intracerebral hemorrhage here. So that's basically blood in the parenchyma and the ventricles. This is commonly due to hypertensive vasculopathy. So let's just talk about the spaces first. So this here is our epidural space. Remember, epidural space is between the dura and the skull, right? Then this is subdural space. The subdural space is between the dura and the arachnoid, right? Then this is our subarachnoid space here. All lower, all this is subarachnoid space. Then this is obviously our brain matter. So whenever we talk about epidural, you need to know where that is. Subdural, you need to know where it is, and subarachnoid, as well as intraparenchymal. So a few facts you need to tell you about epidural hematoma is that epidural hematoma does not cross suture lines. However, subdural hematoma, it crosses suture lines. Epidural hematoma mostly has arterial blood. However, subdural hematoma has venous blood. Then the reason we usually get epidural hematoma is due to a tear in the middle meningeal artery. Then the reason we get subdural hematoma, that's usually due to tear of the bridging veins. Okay. So epidural hematoma, this presents with a convex inner margin, right, and it can cross the midline. So this is our epidural hematoma. Then subdural hematoma, so this presents with a concave inner margin. So here. Then there's under subdural, we've got acute, subacute, and the chronic phase. Then subdural hematoma can also occur in interhemispheric fissures. So acute subdural hematoma. So if you're able to see the yellow color here, yes. So this is subdural hematoma around the front, left frontal lobe convexity here. Then the one in blue here, this is the subdural hematoma along the tentorium. Then the one in red, this is subarachnoid hemorrhage in the sylvian fissure here. Then when we talk about subacute, so subacute blood products will be isodense to adjacent brain parenchyma and could be easily overlooked. So this is yeah. So before we even get into more details, one thing you need to know is acute blood is going to appear white, or maybe we can call it hyperdense. It's going to appear light in color, okay? Then subacute will appear isodense. So that's basically it will be very similar to brain matter. Then chronic is going to appear hypodense, it will be dark in color, okay? So when we look at this, if it's similar to brain matter, so that is going to be subdural, sorry, subacute subdural hematoma. So how would you know that there's actually a hematoma here? You can compare the left and the right sides. You're able to see this here, but you're unable to see that. So that's basically you need to already start suspecting that there might be a subacute hematoma here. So chronic subdural hematoma. So remember we said chronic is going to appear dark, right? So this is chronic. However, if you look at this appears lighter. However, when you get it, it gets similar to brain matter. So there is the possibility this is acute or subacute bleed, and then this was the chronic blood. Then because of the bleed, you're able to notice that the ventricles have shifted to the opposite side, right? They're actually thing here. Move to the opposite side. Then subarachnoid hemorrhage. This is external hypertensity related to subarachnoid hemorrhage. However, one thing you need to know is that the hyperdensity is going to decline with time due to the clot and red blood cell lysis due to resorption of hemoglobin and plasma protein. So if you detect it in the early periods, good enough. However, when you scan a little bit later than it occurred, you might not be able to appreciate anything. So basically, showing blood in the Sylvian system, blood in the suprasellar system, blood in the ambient system here, then the fourth ventricle. So CT scan is able to document the predominant location of the ruptured aneurysm responsible for hemorrhage. Anterior communicating artery hyperdensity in the suprasellar system and anterior aspect of the interhemispheric fissure. The colossal and cingulate gyre are often outlined. So if the subarachnoid hemorrhage involves anterior communicating artery, you're going to notice a hyperdensity in the suprasellar system and anterior aspect of the interhemispheric fissure. Then middle cerebral artery bifurcation. This is going to produce a unilateral bleed within the sylvian fissure with adjacent suprasellar system. So intracranial hemorrhage is something we've already talked about. So acute is going to appear to be hyperdense like this. Then subacute will be isodense, that is similar to brain matter, and chronic will be hypodense, which will appear to be darker. Then this is stroke. So remember we said that ischemia is going to appear dark on CT, right? So this is ischemia and hemorrhage is going to appear white. So basically that's all about how to evaluate intracranial or cerebral hemorrhage. If you like the video, please like, subscribe and comment. Thank you.